Hello, everyone. Welcome to our webinar. We're going to go ahead and get started. Thank you for joining us. Our webinar today is COVID-19, what employers need to know now that states are reopening and closing again. Please note this webinar is being recorded. The information you will hear during this webinar is not considered to be legal, financial, or other advice and is intended to be educational only. Our speakers today are licensed attorneys, but they're not providing legal advice. Always consult with your own attorney or financial professional to ensure compliance with all law applicable to you. Today we're going to first hear from Lisa Nelson. She's an ERISA attorney who works as the Leavitt Group Vice President of Employee Benefits Compliance and Regulatory Affairs and is the HIPAA Privacy Officer. Following Lisa, Vanessa L. Smith will speak to us. She is the Principal and National Managing Director of Vantage Solutions, a national human resource and workplace strategies consulting firm. We will pause for questions after each speaker. You can put your questions in the chat box, either publicly or to me privately, or you can unmute your microphone during our Q&A breaks and ask your questions that way. I think that will do it for announcements, so we will turn the time over to Lisa Nelson.
Thank you, Krista. Welcome to the Leavitt Group webinar, COVID-19, what employers need to know now as states reopen and close again. As Krista said, I am Lisa Nelson and the Leavitt Group Vice President of Compliance and Regulatory Affairs and HIPAA Privacy Officer. It is my job to not only help Leavitt Group ensure compliance of its own, but to assist your clients comply with the various state and federal insurance laws applicable to your plans. After doing this for 20 years, I can say that I love what I do. And as your trusted advisor, we at the Leavitt Group provide many compliance solutions. If you have missed our prior webinars and articles, be sure to check out our news.leavitt.com/COVID-19 site for all of those materials. This presentation will focus primarily on employment law issues arising from the COVID-19 environment complicating usual business operations, specifically related to closing, reopening, and even closing again in some states and school districts. Our speaker today will be Vantage Solutions' Vanessa Smith, the Leavitt Group Preferred Partner for Employment Law. At the start of this presentation, we will reintroduce Vantage Solutions. If you have not been a part of the past webinars with Vanessa, she has offered phenomenal pricing just to our Leavitt Group clients and consults on a range of employment law issues. But before we talk about employment law, before we talk about employment law and Vantage Solutions, I will spend a few minutes highlighting relevant clarifications on testing for COVID-19. Vanessa will talk about testing in the workplace, i.e. employment law, and I will talk about insurance law and testing under the health plan. Recent FAQs clarified how testing under the health plan versus testing for employee safety in the workplace is to be treated. We will be covering highlights of those FAQs. I will also provide a quick segment on the top things you need to know about how COVID-19 may be affecting your health plan, in case you missed the highlights in prior webinars, written educational pieces, or tools the Leavitt Group has already released since the start of the COVID crisis in this country. Vanessa will then discuss how workplace safety testing and privacy interact. Specifically, can the test results be shared to further employee safety? Vanessa will also cover other various changes in the workplace resulting from the COVID crisis. An important topic for many this time of year are the challenges for working parents. I am one of them, due to schools opening or in some areas remaining closed. What should you, the employer, do if a parent cannot return to the physical workplace? What accommodations must be provided? These questions we will answer today. Employees will need COVID-19 testing and in some cases treatment. So now what? I will explain in a high-level general explanation, but I want you to understand there is more to know and nuances in the law. So be sure to work with your trusted advisor like the Leavitt Group or Vanessa to ensure compliance with all applicable law to your specific circumstances. As I said, Vanessa will cover the employment law considerations with testing in a minute. But if the employer is handling testing through the plan, must the plan cover testing? But what about treatment? What about if we are testing as a condition for work? Recently released FAQs address the question of COVID-19 testing in the workplace. Specifically, is COVID-19 testing for surveillance or employment purposes required to be covered by the plan? The Departments of Labor, Health and Human Services, and Treasury said this: testing for health and safety, i.e. return to work and other workplace safety programs, is beyond the scope of recent COVID-19 legislation and other guidance related to the Families First Coronavirus Recovery Act and CARES Act. Such testing is not required to be covered by the insurer, as it is not primarily intended for individualized diagnosis and treatment of COVID-19. Rather, it is intended to ensure workplace safety. Costs related to workplace safety are to be absorbed by the employer. Another FAQ asked about notification timeframes. Typically, changing coverage under the plan, including if it's just for cost changes, that requires an advance notification. For plan sponsors amending their plan to allow for mandated or other even more generous coverage for COVID-19 testing and treatment, they have a relaxed notification standard for the summary of benefits and coverage. Plan sponsors may change their plan to allow for these changes for testing and treatment without the SBC 60-day advance notice typically required. Additionally, if reversing the change after the COVID emergency within a reasonable amount of time in advance of such reversal, no other notice for the previous change is required if provided the notice said it was a temporary change, meaning you could provide a late notice now of the cost change that is occurring now, and in that notice state that is a temporary change during the COVID crisis or another temporary time frame that you assign. It could be longer for the entire plan year, for example, in some cases. And in this method, a new notice at the end of the change that will reverse that no cost or modified plan cost due to COVID for certain COVID testing and treatment, you won't need another notice. So that notice that you're doing now or right about now that is late and permitted to be late, if that notice states that this is a temporary change, then another notice later would not be needed. The FAQs also address balance billing. Balance billing is prohibited. Providers will be reimbursed either a negotiated rate or the publicized cash price. In either case, the amount the plan or insurer reimburses the provider constitutes payment in full with no cost sharing to the individual or other balance due. For out-of-network provider reimbursement, insurers and plans must cover testing at no cost as well. Under the Affordable Care Act, reimbursements for out-of-network coverage is dictated by the ACA payment standards. And in the case of COVID-19, the rules were amended only for the COVID-19 crisis. So if someone receives testing out of network, say in an emergency room, the CARES Act would typically say how to treat that out-of-network cost. But the CARES Act requirement will supersede the ACA rule for payment. That is, the reimbursement or payment for out-of-network will be either the listed cash price posted online, which is required per transparency rules, or it should be, or the negotiated rate, not in adherence with the ACA payment standard, but as an exception to that standard. To allow for ample Q&A time and for Vanessa to focus on what employers really need to know now as states and schools reopen and close, we're going to do a lightning round of what you need to know now for group health plans in the age of COVID-19, at least to date. When states shut down, telehealth became a lifesaver, literally. Rules such as a prior relationship with a doctor and patient or in-state patient requirements were relaxed to allow telehealth for any reason throughout the rest of the year and with no deductible for any reason, not just for COVID-19 testing and treatment. Also, with no deductible is the COVID COVID-19 testing and treatment for high deductible health plans. As you know, testing is mandated throughout the country at no cost to the employee. The plan will cover the cost of testing, not the employer, but there are restrictions as to where and how the tests are performed. So please consult your plan terms for those specifics. Testing, even using at-home tests, are reimbursable. They must be, however, for individual diagnostic purposes and not employment health and safety, which must be covered by the employer. If conducting on-site testing for employee safety, as Vanessa will elaborate on, HIPAA does not apply. HIPAA only applies to protected health information created or received by the plan and used for the plan's purpose, not when operating as an employer. Vanessa will talk about the rules that apply when operating as an employer. Treatment with no copay is also mandated for insured plans in some areas, including California, Vermont, Minnesota, Massachusetts, and New Mexico. And this is ever-changing list, so don't take that as the only ones. Your plan will comply with this for you. Self-funded plans are not required to comply with state insurance law. Many insurers are voluntarily waiving this cost sharing as well, so consult your plan for details. If you have a wellness program, you may relax those standards required to meet incentives for your plan. Provide a notice to plan participants to ensure proper notification, and always keep such notices for your compliance records. Due to the multitude of employer and plan challenges resulting from massive employment changes and complications with the opening and closing and furloughing and putting on leave, the Mental Health Parity and Addiction Equity Act provision that says substantially all employees must benefit in order for that benefit value to qualify for the quantitative analysis to determine mental health parity compliance. This is subject to non-enforcement due to the COVID-19 environment. That means the rules were relaxed. COBRA notices, election notice included, Form 5500, SBC, and other notices have been eligible for a delayed option, in most cases to expire 60 days after the end of the national emergency, which has not occurred yet. We are in the national emergency. So there's no end date for those COBRA notices. For the 5500 and the medical loss ratio rebate report delays, each rule provided a deadline. So be sure to subscribe to the Leavitt Group news alerts and see news.leavitt.com for more information on these. If and once there is a delay announced for ACA reporting, we will release that information to the subscribers there. Before moving on to employment law considerations, let's open up for a few questions on the topic of insurance considerations that we've either just gone over or even others that we have not covered. If we do not get to your question, we will discuss this in Q&As following the presentation and provide that to you. Krista, do you have any questions?
Thank you, Lisa. I don't see any questions in the chat. If any of you do have a question, now would be a good time to unmute and ask the question, or put it in the chat. And if not, we can just wait a couple minutes and turn that over to Vanessa then.
Sounds good, thank you.
All right, then why don't we move on? We can pause for questions again later on in the webinar. At this point, we will turn it over to Vanessa Smith.
All right, good afternoon. Thank you so much, everybody, and welcome to those who may be joining for the first time, and welcome back to those who have joined us in the past. I think this is now our third or possibly fourth seminar discussing the legal and practical implications of the coronavirus pandemic, and helping employers who are facing these challenges. So I just want to say that I, along with my team, Advanced Solutions, are very honored to be able to support the Leavitt Group, to be a preferred partner, to be able to work with all of you as well as all of your clients on matters facing the workplace. Here we go. I did want to spend just a moment talking about the services that we provide. So again, very honored to be able to work with you all. We've definitely supported many of your clients with COVID-related advice and counsel. That seems to be the world of employment law right now. It's always COVID all the time. And so trying to help HR departments and small businesses just deal with the impact of states opening up again and closing again, and everything that's going on with our schools, and trying to support working parents and run your business all at the same time. It is definitely more than a notion. So in addition to that advice, we also provide just general employment law advice and counsel. So if you think about your daily employment decisions, who to hire, when to write people up, when to terminate, situations that might call for immediate termination versus something that might be more of a progressive discipline situation, making sure that you are complying with the FMLA if that applies to you, the ADA if that applies to you, EEOC regulations, which apply to almost everyone at this point, whether it be federal or state law, and then the Fair Labor Standards Act, which also applies to everyone and relates to making sure you're paying people appropriately and properly. Our team supports affirmative action planning for those of you who may be federal contractors. We can support you making sure that those plans are in order, and sometimes that also begins to drive diversity, equity, and inclusion work, which is of course another really hot button item that is employers are facing right now in terms of making sure that they're creating equitable and inclusive workplaces. We support clients with agency representation with agencies such as the Equal Employment Opportunity Commission, your state law agencies that address workplace equality, the Department of Labor, the OFCCP, all of those agencies we can provide a response to. We also help our clients with audits. If you want to either do something proactively, or if you are faced with an audit from one of those agencies that I mentioned earlier, we can help you to ensure that you are complying with relevant information, not oversharing, if you will, and that you are working through that process as seamlessly and painlessly as possible. A big thing that we see is exempt or non-exempt classifications, making sure that our clients have those in order, supporting policies, procedures, handbook development, all of those sorts of things, as well as investigations of internal claims. So ideally, you all have something internally that if someone feels like they're experiencing something that is inappropriate in the workplace, they have an internal means to address that before they go externally to a government agency. And so we can help as an outside third-party team to come in and investigate those claims for you. So I just wanted to share that. As Lisa mentioned, we have worked out an arrangement where we're able to offer very favorable pricing to you all as the Leavitt organization. And so just want to make sure you know all of the things that we can support you with. There's probably a lot more than that, but I wanted to just highlight those briefly in today's call. So thank you for allowing me to do that. So talking about COVID, COVID is a compliance challenge, to say the least. And the primary reason for that is that there are so many employment laws that impact this situation, or that are impacted by this situation. This is a kind of the rundown of them. Everything from workplace safety, the National Labor Relations Act, which allows employees to talk about things that are of concern to them in the workplace, and therefore may allow employees to, complain about what you are or are not doing as an employer, and to do so lawfully. The Americans with Disabilities Act, the FMLA, is obviously implicated. As a result of the COVID pandemic, we all know that there have been several stimulus acts that have been passed at the federal level. And the one that is the most critical from an employer standpoint as it relates to the opening and closing of the workplace and of states and of schools and all of the above is the Families First Coronavirus Relief Act. We affectionately call that the FFCRA, and we'll talk about that. There are state wage payment acts that may implicate what you are required to do when you do have employees working from home, whether or not you're required to reimburse some of those expenses. And then you have your standard EO, equal opportunity provisions as well, which are designed to ensure that whatever you're doing in this situation, you are doing so fairly and equally for everyone in your workplace. All right. So with all that being said, I've said this many times before, this is a balancing act, and it really requires you as employers to balance all of the regulatory obligations that you have with the need to just continue operating your business, right? This has put a strain. We've all seen the numbers and heard the numbers, the businesses that have really suffered or even have not survived throughout this process. And so we obviously want our businesses to not only survive this, but to thrive during this. And that just requires a balancing act. We talked quite a bit in past webinars about preparing the workplace. So ensuring that you are properly disinfecting and cleaning and all of those things, making sure you have PPE. We're not going to spend any time on that today. I think everybody kind of has that in place, not only for the workplace, but also probably what you're doing on a personal level at home, wearing masks, the things of that nature. Communication and engagement. We talked a lot about the importance of really over communicating around what you are thinking, what you are doing as it relates to COVID and your workplace. This fosters a sense of transparency, which helps with trust. And trust is really what's needed here, meaning that you want your employees to have a deep-seated sense that you care as much, if not more, about them as people as you do about your profits. That's what's going to keep employers with you throughout this process, even when there are ups and downs, even when you have to furlough or lay off or things like that. That is what is going to bind your employee population to your organization, as opposed to having them looking for the first way out as we start to emerge from this pandemic. We are going to talk today about returning to work. We're going to talk about reasonable accommodations. We're going to talk about ongoing environmental safety. Lisa mentioned testing and screening, and what do you do if someone tests positive, and all of those different things, notification and privacy issues, all of which are implicated by your need to know so that you can create a safe environment for everyone in the workplace. And then we are going to talk about some of the considerations for all of your employees who have returned to work, and how some of the FFCRA provisions impact particularly those. We're getting a lot of questions from parents or about parents and how to deal with what's happening with our schools as they too open and then perhaps close again. All right, so I talked about OSHA compliance. OSHA is the Occupational Safety and Health Act, and it requires employers to provide a safe working environment. All employers are covered by OSHA. Oftentimes we think of OSHA in the context of heavy manufacturing or things that have a particular sense of danger, but all employers are required to make sure that they are providing a safe working environment. So in the past, if you've been with us, we have used our fictional character, our HR person, Sarah, to kind of walk us through some of these questions. And Sarah she has been really going through it, facing these challenges, but we're going to make sure that we can help her get through that. So Sarah's been communicating. She's been explaining what the return to work plan is for her organization. And as you can imagine, you may have experienced this in your own workplaces. Several of her employees expressed fear of contracting the coronavirus by returning to work. So can Sarah insist that they return to work? So as we say, the first thing is communication. Making sure that you understand the concern. Sometimes it is just that the employees do not understand all of the measures that you are taking to mitigate this concern in the workplace. And once that is clarified or reiterated, or sometimes it's just saying it a different way, then they can get comfortable with that return to work. If that is not the case, then the test that you are looking at for OSHA is the imminent danger test. If that test is met, the employee can insist that they stay home, and you cannot prevent that. So that test has 4 components. The first is threat of danger or serious physical harm. The second, reasonable expectation that there is a hazard present that would reduce the physical or mental efficiency. The third is that the harm is immediate or imminent. And the fourth is that it cannot be mitigated through inspection and remediation. And so if there is the possibility that there is someone in your workplace that has COVID-19, then that is going to pretty much meet all of these requirements. COVID does present a threat of serious physical harm, and it's one of those things that certainly there are people who are known to be more vulnerable and in higher risk categories, but really it can impact anybody in a particularly serious way at any given time. So what you're going to try to do as an employer is make sure that that reasonable expectation piece cannot be met. You do that by mitigating all of the risk, by making sure that you put, again, those measures in place to create safety in the workplace, to protect against people coming into the workplace who may be symptomatic of COVID or who may have COVID, that you properly quarantine those, that once you learn. So all of those mitigating ways that you are going to put in place to ensure that COVID does not enter your workplace. That is what you're going to focus on here, because if you have done those things, it will be very hard for anyone to prove that there is a reasonable expectation. Now, someone may always have that fear, and that is something that obviously, you want to try to alleviate as best as you can. But if they have that fear and it is not reasonable, then you will not be held responsible for that, and that would be your defense. So making sure that you're doing those things to eliminate any reasonable expectation that COVID is present in your workplace is what you want to focus on as it relates to the FMLA. So we know that the FMLA provides employees with paid job protected leave for their own serious health condition or the serious health condition of others. So COVID-19 is maybe a serious health condition under certain circumstances in the traditional FMLA model. And the FFCRA provides for extended FMLA leave that is specifically related to COVID. So a serious health condition, as you probably know, has 2 key factors. One is that it involves inpatient care from a physician or ongoing care. So generally speaking, yes, we consider COVID-19 a serious health condition, but it certainly depends on how COVID impacts that specific individual. We know that the vast majority of people who contract COVID do not have significant symptoms. The symptoms were very mild. And so in those instances, if they are not seeing a doctor, if they are not required to take time off, if they're not required to see a doctor twice or have 3 consecutive days out related to that, then they may not qualify as a serious health condition. The next law is the ADA. So we are going to just be reminded that the ADA requires you as an employer to make a reasonable accommodation to the known disabilities of employees unless to do so would be undue hardship or the employee poses a direct threat. We're going to talk about a reasonable accommodation in a moment, so I'm going to focus here on the direct threat. So in this instance, unlike with OSHA, where if it's imminent danger, the employee may choose to stay home. In a direct threat, if this test is met, the employee cannot be permitted to enter into the workplace, or you as the employer are facing liability. So here we're looking at a significant risk of substantial harm, health and safety, the health and safety of others, and again, that it cannot be eliminated or reduced by a reasonable accommodation. So the EEOC has determined back in April of this year that an individual with COVID does pose a direct threat to the health of others. Kind of period, end of discussion. So if someone has tested positive for COVID, they have to get out of the workplace. All right, so we know the situations where the employee who expresses fear can be kept out of the workplace. Here, we have an employee who requests to work from home as a reasonable accommodation. So is Sarah required to provide this? So there are two considerations here I want you to think about. The first is the legal requirement. And so we know that a reasonable accommodation is one that allows an employee with a disability to continue to perform the essential functions of the job. And so here what we're looking at is what are the essential functions of the job? And so if the essential function of the job is that you have to be at work, right, and that has been defined, then it would not be a reasonable accommodation to have that person working from home. If the essential functions of the job do not clearly state that, or cannot be shown to be that, then it's a little bit more of a challenge, right? So you want to make sure that in your job descriptions, you have your essential functions clearly defined and whether or not it does require work from home. Now we get the question all the time, well, we've been working from home all this time, so how does that work? That is a great question. And so the way that that analysis is going to most likely play out is that if the work has been able to be accomplished successfully in a work from home environment, as you can imagine, it's going to be kind of difficult for you as the employer to now say, just because it's September 10th or September 11th or whatever day it is, that all of a sudden that is no longer possible. So in those instances where the full job has been able to be done successfully in a work from home environment, employees are going to have a pretty strong argument that could and should continue for them. However, if you are able to demonstrate that there are parts of the job that you had to basically overlook or not require because of the circumstances of, states and everyone else being shut down, so you could not have people going to the office, then you stand a much better chance of being able to say, well, yeah, but that was an exception and we, had to eliminate certain parts of the job for this period of time. Now that we can have folks return, we want to put those parts of the job back in. If you have documented any of that, either internally or hopefully with your employees, all the better. So that way everybody's clear that this is now, and when things change, we're going to return those essential functions to the expectations of your job, which includes coming back into the office. If a reasonable accommodation is requested, you do have to engage with an interactive process. Those of you who are covered by the ADA already know this, I'm assuming, and so you know that working with that employee, really understanding their needs and their concerns is really important, and that you want to make sure that you are documenting that. The undue hardship test continues to be one that is very high burden of proof. It is almost where the law considers that the financial burden has to be so great that the business would almost not be an ongoing concern if you had to make that reasonable accommodation. And so we know that that's going to be unlikely in most instances. In addition to the legal requirements, we are recommending that employers consider having a policy that specifically speaks to this particular issue. And by that I mean, it's not legally required, but as an employer, we are going to establish in writing for everyone to know and understand, so that we do not find ourselves in a situation where we're discriminating against people, but we are going to establish a policy that addresses particular COVID-19 related requests. What are the permissible reasons that may not meet the legal standard, but that we will consider allowing an employee to work from home under these circumstances? A couple of examples. I don't have a disability, but I live with someone who is at high risk, or I'm a caretaker for someone who is at high risk. Other situations like that, you can set out a policy saying, these are the reasons that we will consider allowing you to work from home under these circumstances, and here is the documentation that we're going to require. So again, whether it be medical documentation or some sort of self-certification from the employee where medical documentation is not possible to obtain, setting that forth very clearly and working that process through in your own mind about what is acceptable and what isn't will just avoid you getting to the place where you have that request and then you don't know what to do. Likewise, related to that, we recommend establishing a process which of course is going to include those interactive discussions. So whether it is an email that goes to HR, whether it's an official form, whatever it is that you're going to require, so that you are clear when someone is making a request under this policy to work from home or have some other accommodation related to COVID. And then this policy, if you choose to enact one, it's not required, it's just a recommendation and a best practice that we have found as we've helped clients to work through these challenges, would of course be a supplement to your existing ADA policy. So you'd be doing both. You'd be doing more than the law requires for this particular situation, and to make sure that your employees feel safe and that you maintain a safe work environment. All right, so continuing on with our reasonable accommodations. Despite these efforts, the employee just refuses to come to work. So many of our clients want to know, at what point, if any, am I allowed to terminate that particular employee? And so there are really 4 requirements. If there's no imminent danger under OSHA, if there's no direct threat under the ADA, if there's no reasonable accommodation that can be found after you go through the interactive process, or if that reasonable accommodation would be an undue hardship, again, very high standard there, the employee can be terminated at that point if they just fail to show up. As long as, with 2 caveats to that, they don't have any regulatory protected leave or any regulatory required leave, which we're going to talk about in a moment, all of which has come about as a result of the stimulus bill, specifically the FFCRA. Okay, so now Sarah's ready to reintroduce workers to the workplace. For duty information can she require, and how can she approach this? So traditionally, your fitness for duty information is going to be a doctor's completed form. On the form that is provided by the Department of Labor, the EEOC has recognized that this is likely not really practical under the current circumstances. So looking at some new approaches, the one that we've seen clients use the most are the last 2. One is the employee's word via certification. So basically you're having an employee certify that they, have not tested COVID positive. They have not been exposed to anyone who has tested COVID positive in the last, 7 to 14 days. Or you are going to actually have employees get tested and provide you those testing results before they return to the workplace. And that can be external testing, or that can be testing that you as the employer administer. All right, so now this is kind of a new one that we're starting to see, where an employee who returns to work is frustrated because other people aren't required to return to work, but they are allowed to work from home, right? And so it just feels unfair. Why do I have to come and they don't, right? And so how should Sarah handle this? So obviously, I'm sure you recognize in that question this idea of, well, why do I have to come and they don't, right? They're seeking out information, and it's information that you can't share, right? Because it's information that could potentially disclose private information. Certainly, if it is an ADA required accommodation, you would be disclosing a disability by sharing with this employee why you gave this other person an accommodation. And we all know that that is a no-no. Similarly, even if it's not an ADA required accommodation, but just one that you've chosen to offer during COVID, it still could potentially violate privacy concerns and just not the information that you want to share about someone else's family situation or whatever it may be. So you have to make sure that in answering this question, that you don't disclose that confidential health information or that the individual has a disability. So the EEOC says a statement that an individual receives a reasonable accommodation, almost by definition discloses that the individual probably has a disability, because only individuals with disabilities are entitled to reasonable accommodation under the ADA. So you want to be able to avoid that, okay? So what we are advising is that, again, communication, right? So the employee is concerned about something, and maybe they just feel, angry and frustrated, but maybe they really feel like they should have gotten a reasonable accommodation as well, right? So you can ask more information to determine, are they asking for their own accommodation? And if so, for what reason? So again, you want to follow the ADA interactive process, or if you've put in place a COVID policy, as we recommend that you follow the process for that as appropriate and give that person a fair opportunity to also work from home as they are expressing frustration around that. Okay, so as employees return to work, Sarah wants to mitigate the risk. This is what I said earlier, this idea under OSHA of a reasonable expectation. So you want to make sure that there is no reasonable expectation that someone could contract COVID in your workplace. And here's some of the things that you want to do as it relates to your employees. So the first question Sarah's asking is, can I screen for symptoms? We've been talking about this for some time because many people establish those types of procedures, and the answer is yes, you can. They need to be standard and consistent screening measures. So whether it's daily or whether it's every other day or once a week, whatever your standards are for how often you are going to screen for symptoms of COVID, you need to be clear about that. That should be certainly developed as a standard operating procedure in the back office, if not shared as a policy in an employee-facing sort of way. So the EEOC has said you can do fever checks. Anyone who has symptoms can be required to leave work. This, of course, aligns with CDC guidance as well as public health guidance about the types of symptoms and what should require self-quarantine. You obviously have to be mindful, certainly as it relates to symptoms and arguably as it relates to testing as well, that your results can be both under as well as over-inclusive. We know that all symptoms are not always present, and we know that certain symptoms could be symptoms of other things that are not COVID-19. But the key there is to establish something that is standard and consistent. The second part of that is, okay, great, I have this policy. Now who's going to enforce this policy? Who's going to actually take these tests? And here you can imagine all the things that could go wrong if you have someone who is not trained, who is not comfortable, someone who is not discreet, actually engaging in this process. So you really want to make sure that you're very careful about who you're going to assign to do this very important, very confidential work on behalf of your organization. Depending on the locations you have, depending on the various means of entrance, you may have to, sort of route people or really change all of that so that you have people coming all through a single place, so that you have your folks who are trained, who have adequate PPP, which includes a no-touch thermometer, of course, there at that location. You want to ensure that your confidentiality is maintained, of course, so whatever findings, whatever symptoms people may be showing or whatever you reveal, that has to be not only documented, but maintained in a confidential manner. So the biggest thing here, remember, under the ADA, taking someone's fever every day is considered a medical exam. The EEOC has effectively eliminated all of the restrictions around conducting medical exams so that employers can make sure that they keep a safe work environment. But the documentation required behind that is still fully in place. Has to be kept separate from other personnel files, and you want to make sure that you maintain good records of that so that you are still in compliance with the ADA. Related, testing. So now Sarah's concerned that an individual employee might be sick. Can she require testing? So again, you can establish those testing requirements that are consistent. So think of this like you would random drug testing, or not random drug testing, but drug testing, right? What are the criteria that are going to trigger you to test an individual employee, right? And obviously, if you do drug testing of any sort, you know that doing it on an individual basis can be a little bit tricky, which is why so many employers put in place random drug testing, right? Or they do drug testing for everyone in certain roles. So here, you can certainly do it on an individual basis, but the recommendation is that you do it for everyone at certain intervals so that there is no suggestion that there was any sort of discrimination. So you can require self-reporting. If employees are doing their own test, you can require that they report those results. You can, of course, require that anyone who does test positive immediately leave work. They do pose a direct threat to others in the workplace, and under the ADA, you are required to have them leave the workplace. You can also do your own testing. You can make it mandatory because it is job-related and consistent with business necessity. It is absolutely necessary that you maintain a COVID-free workplace to the greatest extent possible to protect yourself, to protect your employees from, disease and infection, and also to protect yourself from legal liability. As an employment law community, we definitely believe that there's going to be significant litigation arising from the COVID-19 pandemic. And there, so much so that there is some legislation that is being introduced to basically prohibit employees from suing employers for COVID-related disease, COVID-related illness, termination, any of the above, right? And it's probably unlikely that those laws will get passed, but the fact that there is that effort just kind of shows you the concern that the business community has around all of the potential liability that can come from as a result of this dynamic. So the test, of course, must be accurate and reliable, so you want to make sure that you follow FDA guidance. All right, so one of the employees tests positive. How is Sarah going to handle this information? Already said, immediately send that employee home, conduct contact tracing. So you're going to ask that employee, tell us who you've been in contact with. You can also do it based on the area. Identify those with whom they might have been in contact with in the past 14 days. And you would advise privately those that they may have been exposed to the virus. You may consider sending those who have been exposed home to quarantine as well. This is no longer required by the CDC or no longer the advice of the CDC, so you're not required to do it. But could still be a good consideration in your workplace depending on how your people work and how closely they are in proximity to one another. You do want to communicate that there has been potential exposure, that there has been a positive case. You might want to identify which areas have been impacted, again, depending on how tightly you are keeping people in certain areas of the workplace, you may be able to identify that with a lot of ease that, hey, it's going to be area A, C, and F that have been impacted. So the tight, as you think about bringing people back, the tighter that you can keep people in certain areas and know where they have been, the easier your contact tracing is going to be. You cannot and should not identify the employee by name. That would be on a need-to-know basis only. For example, their manager, they are no longer able to be in the workplace, and even then, you don't have to express why. You just have to make sure that that person has the support that would have been provided by that employee. So not only does it violate the confidentiality of medical information, but it can also create the basis for what is called a perceived disability under the ADA when they return to work. So you want to try to avoid that. You do typically need to disclose to the public health authorities in your area. So that's what's happening with employees who are in the workplace and how you're dealing with employees who are potentially sick or actually have contracted coronavirus. So now I want to talk just a little bit about the provisions of the FFCRA that are allowed for all working employees. I bring this up again because so many of the questions that we're getting right now have to do with parents, working parents, and what's happening with our schools, and the fact that there's a lot of fluidity in terms of what's happening right now. So here the scenario is employees who are expected to return to work require time off, and there's obviously a ton of reasons for people to require time off. One of the ones we're going to focus on is because they do not have childcare, their children are out of school. What are the obligations to provide leave, and is it paid or unpaid? So the FFCRA did introduce two new leave provisions. The first is the emergency paid sick leave. As its name implies, it is paid. It is for sick leave. There are certain requirements or criteria that have to be met, and it is 2 weeks of leave. The second is the Family and Medical Leave Expansion Act. This is, as its name implies, an expansion of the traditional FMLA FMLA to account for those situations where those COVID-related situations that would not otherwise be considered a serious health condition or otherwise be considered qualifying for the FMLA. And the government has said, because of what's happening, we're going to make sure that these situations apply. So there are 6. And so the first 3 have to do with being subject to quarantine or isolation. A lot of that has passed in many areas. And so there are necessarily traveling, and then there may be. But number 3 is certainly very much valid, experiencing symptoms and seeking a diagnosis, or caring for an individual who is subject to quarantine. 5, caring for a child when childcare or school is unavailable, very much still applicable. And then number 6, some other condition which has not been determined, so that one does not apply as of yet. So the emergency family medical leave is eligible only when the employee has been employed for at least 30 days. And this one specifically applies to where the school is closed and the employee must be at home to care for a child. Now, right now, schools are doing a whole bunch of different things, and they generally fall into 3 categories. 1 is we are closed, all learning is virtual. 2 is we are open, please bring your children to school. And 3 is a hybrid, right? So either kids are going to school a limited part of the day, children are going to school for a shortened week, and then there's a hybrid of at school and in home learning, or as the case with my daughter, there is 1 week on and 1 week off. So 1 week you're at school learning and 1 week you're out of school learning. So what the new sort of analysis based on these evolving circumstances, and the analysis is, if you have a choice, your school is not closed. So if the school is closed and you do not have a choice, this FMLA emergency leave applies. But if you have the choice, you are choosing to have your child at home, then it would not apply. So what the emergency or the expansion leave does is it's available for 12 weeks. It is job protected leave. You can substitute your PTO for the first 2 weeks to be paid, just as you would with any other coordination of leave. Hopefully you all already have that written into your policy. So this is just an extension of that. Notice is required, same as it would be under the FMLA. This gets into the payments that are required for full-time employees and for part-time employees. It is a function of which of those criteria your employees meet. And it ranges, again, 80 hours at your regular rate for paid sick leave, up to 80 hours at 2/3 of the rate, all the way to 8 for certain conditions under the Expansion Act, all the way up to 2/3 for 10 weeks for other conditions, specifically the ones related to childcare. So a person who needs to be off work related to childcare, and meaning they cannot work from home, they have to be off work related to childcare, is entitled to 2/3 of their regular rate of pay for up to a total of 12 weeks, and that is job protected leave up to $200 per day, or $12,000 maximum for the 12-week period. Traditional FMLA still applies. We talked about that a little bit earlier. And so again, paid sick leave is not job protected leave. If the position is available, they can return, great, but if it's not, you're not required to return them. Traditional FMLA leave, of course, is always job protected leave, as is the expansion FMLA leave. That also is job protected leave. So as you get ready to bring people back from any of those situations, those are your obligations. So finally, Sarah's just exhausted with it all and decides to just scrap all of the return to work and issues a mandatory work from home policy for all of her employees. What are the considerations here? And there really are just two big ones that you need to be mindful of. One is state laws often require reimbursement for the expenses incurred while working from home. In Illinois, for example, it is anything that is a direct consequence of the discharge of duties. So things like internet, phone, all of those things now require reimbursement from my employer, because I have to work from home and I have to have those things in order to enjoy Zoom calls such as this. So again, you want to establish a policy, use compliance as your minimum standard. You may decide to pay for other things or reimburse other things that would more closely mimic what would be happening if they were actually able to come to work. That's perfectly fine. Again, you can always do more, just make sure you don't do less. And then the other big one is for non-exempt employees in particular. So if you think about your administrative staff, that you still need their support. They are non-exempt, they're hourly workers, they're working from home. You just really want to be mindful about all of the after hours access, all of the after hours emails and phone calls and Zoom calls and whatever it may be, because that is technically time worked and could really blow your overtime budget if you are not. Finally, the EEOC laws still apply. And I've mentioned it a couple times, but you want to make sure that in taking all of this action, you are doing so consistently and not in any sort of discriminatory way. And I think I hit 2 o'clock right on the nose. So I apologize. I know we want to allow some time for questions. So I'll turn it back over to Krista and Lisa for kind of how we're going to deal with that. But I'm certainly happy to answer any questions that anyone has.
Thank you, Vanessa. Krista, if you could open up questions, please.
Yes, we do have one question in the chat right now. It's about the extended FML. When does it kick in? Is it 12 weeks from the decision to reopen?
Yes, yes, it will be 12 weeks from the request, right? From the requested date that the person makes the request. And you want to make sure that that person has been working with you for 30 days. And of course, this only applies to employers with between 50 and 500 employees.
Great, thank you. There are no other questions in the chat right now. Lisa, did you want to finish up here before we close?
Sure, thank you, Krista. So there are a lot of unanswered questions with recent rules that came out. They're unfinished. Rulemaking takes time, and there is some leniency in some of the laws, except for mostly what Vanessa spoke about today. There are some good faith standards that we apply in order to get us through this area of some vague rulemaking. And Leavitt compliance will be sure to inform you of any important changes affecting the insurance benefit plans. And when it comes to employment law, reach out to an employment law expert like Vanessa to help navigate the plethora of rules governing employers. Any additional follow-up, or if we get questions following this presentation, feel free to send it along, and we will provide that in an email following this presentation. A recording will also be available. So thank you for your time. Stay healthy, stay safe, and until the next time.